So welcome to part 2 of this series on communicating effectively with reporters and the public. In this section, we're going to talk about who are the media, who are these reporters that we hear about, and what do they want? So basically, on the right-hand side, you can see the kinds of media we're talking about. And this includes it's what you think of as mainstream media, newspapers, magazines, television, and radio, but increasingly niche websites and publications and blogs that are much smaller operations, but have much the same ability to reach people and get stories out there. And then, of course, when we talk about the media, those who are seeing our information on Facebook and Twitter are not reporters, they're direct consumers of news. And so that's something that's changed quite a bit in the last 5 years, with having a lot more ability to reach out to the public directly. On the left-hand side, you can see that U of M has many components, and we're all trying to reach the public through the media or directly, and the public relations staff are here in the middle trying to be the go-betweens, the handmaidens, and those who broker the interactions between the University of Michigan and the media and the public. So U of M, of course, is looking to bring in patients and bring in staff and students and trainees, make sure that we fulfill our public health education and research missions, make sure that our reputation is enhanced and protected, and be recognized among our peer institutions, and make sure that we continue to bring in research funding and fill clinical trials. On the media side, what they're trying to do is inform and entertain in some ways, and also to make sure that they're first, best, most compelling and accurate, and that they are operating within the constraints of whatever medium they're working in. If it's television or radio, often it's time is the biggest constraint. They don't have much time to tell a story. If they're a newspaper or magazine reporter, they don't have much space. But if they're online, they have different ways of engaging with readers, but people read differently when they're reading something on a screen. So those are the kind of constraints we're talking about. And obviously all of them are trying to get more eyeballs, more ears, more readers, and sell advertising if they are not a public media entity. So the kinds of interactions that you might have with reporters include a sort of traditional route of press releases and interviews on your research. And press releases used to be just aimed at reporters for the press, but now they're written so that pretty much anyone can understand them, and that they can be shared broadly in many different ways, so not just with reporters. But we also find that reporters reach out to academic faculty and leadership for expert opinion on different issues. They might be doing stories on new services that we're offering or clinical trials that we're offering. They might be doing a story on a particular disease or a particular treatment and reach out for information from places that provide that. We also have reporters who contact us to see if they can find an expert to comment on a particular piece of research coming out of another institution, and looking for someone in that same subfield to evaluate that relatively quickly and give a comment that they can use. They also do the same when there are societal issues or trends. And we also, of course, have times when we want to have our patients profiled in the media, or patients seek the media spotlight themselves, and we wind up getting drawn into that because the reporter wants to speak to a member of their care team. We also, of course, have situations where reporters are calling about negative situations, what you might call crisis or problem situations. And we'll talk about that more at length in part 5 of this series. So reporters in general are serving a general audience. They don't have a lot of scientific knowledge themselves. There are, of course, some physicians who work in the media and some scientists, scientifically trained individuals, but by and large, most reporters stop their science education in the 10th or 11th grade, or maybe some college work. So they also, even if they have scientific training, it is their duty to make sure that they ask questions from the perspective of their audience. And if it's a general audience, they might ask a question that seems dumb, but what they're looking for is an answer that will come in layman's terms, and that they can really represent the interest of their audience. And you'll find that quite a bit. They want to know, what does this mean for the layperson? And often that also means, when will this research have an impact on everyday life? So often they are on very tight deadlines, and they have little space or time to tell the story. And we have had in the last decade an ever-increasing crunch on the reporter workforce, that there are fewer and fewer reporters, fewer specialists in science and medicine, and they have less time and are being asked to tell stories not just once a day, but throughout the day. And they're always looking for something new, and they have very little time. They also are very independent, and this is true of almost every reporter you'll ever encounter. They don't give you their story ahead of time to review, unlike your PR person. They might tell you what questions they at least think they could ask you. They might allow you to review your quotes if you ask, but the idea that they are independent and not part of the institution, not working on behalf of the institution, and make sure that you understand that when you're interacting with them. So that is why your institution and most institutions nationwide have public relations staff members. We are the middlemen and middlewomen to make sure that the institution interacts with the press and the public in an effective way. What we often do are looking for ideas throughout the institution, trying to figure out the best ways to tell those stories. We do a lot of writing and reviewing with you of materials that can represent your work. And we also think about visuals, images, and video, and graphics. We work directly to send story ideas to reporters or post them on websites where reporters look for story ideas. We also engage directly with the social media outlets that the university and the health system operate. So the health system has official Facebook page, an official Twitter feed. The university has a Twitter feed just for research. And these are ways of reaching out to the public directly. We also do a lot of matchmaking, taking the call from a reporter who needs an expert, finding them the right expert from among our faculty. And we also think ahead for large communications efforts on major initiatives. And whenever a faculty member is contacted by reporters, we are always there to counsel them on what that interaction might be like and help facilitate it. We also have a rule here that any cameras that are from the news media in our clinical or research environment need to be escorted by a member of the public relations team. And we also do a lot of reporting to tell the institution what we are achieving, how many news articles are appearing, how many hits on websites and likes on Facebook pages. And we also are always preparing for and responding to critical issues and sensitive issues and crises. We have a lot of different ways we get the word out. We do press releases, we do photos and videos, we call reporters directly, we respond to inquiries. Like I mentioned, we do a lot with social media, post things on lots of different websites that we have the ability to post to. And we also reach the internal audience, the university community of 50,000, 60,000 people. We reach alumni and donors through publications aimed at them. And we also help our colleagues who are in direct contact with referring physicians to make sure that information germane to them gets to them as well. And our friends in marketing who are doing printed materials aimed at patients and caregivers. But like I mentioned, everything has changed in the last decade in the world of media. The mainstream media used to be the gatekeepers of major stories. No longer. There's a lot of information that goes straight to the public, especially from large institutions that have good name brand recognition, like the University of Michigan. We also find that patients and donors and advocates are out there looking for information and receiving Google alerts when anything new comes along on the particular topic they're interested in, and sharing it and spreading on information and news themselves. We also find that visuals have become much more important, that every story needs to have a compelling photo or graphic or video. And that YouTube is the second largest search engine in the world as far as people looking for information. And we also know that the time scales for especially crisis situations or hot news, time scales have become much compressed. Within minutes or an hour, something needs to be out when something new hits. In other words, if it's not on the web, it doesn't exist. So part of this process of publicity is also thinking about how your work and yourself are represented on the web as you go out and engage in publicity. In the next section, we'll talk more about how to interact with reporters.